One of the most common questions I get asked, particularly when a cat caretaker is concerned about chronic kidney disease, is how much water should my cat drink? Or this comes up when you are concerned about trying to prevent chronic kidney disease. And you'd think the answer should be very basic and straightforward, and I should be able to give you a number. But not only is it not basic and straightforward, what your cat's drinking habits indicate isn't always necessarily basic and straightforward either. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. In true cat fashion, we're talking about something that can be relatively complex. Most people focus on the exact number of milliliters or ounces their cat should be drinking per day. But that's not the whole story. If your cat's drinking pattern shifts, that's when we should be paying attention. Let's look at how veterinarians interpret these numbers and what these changes can mean to you. Let's begin with the basics. A healthy adult cat should be drinking about 50 to 70 milliliters of water per kilogram per day. For most small to medium cats or our average healthy weight cat, we're typically talking about 7 to 12 ounces per day. This range comes from veterinary medicine internal guidelines and reflects what we typically see in the healthy hydrated cat in clinic that is eating a commercial food. However, it's really truly just a guideline. It's important also to keep in mind that that number reflects all sources of water. So that's food, that's treats, that's what they're physically drinking, that's wet food, that's dry food. It's all of the things combined. And yes, contrary to popular marketing myths, dry food or kibble does include moisture. It's not as much as canned food, but there is moisture in there that we need to take into account. It's not uncommon for a cat on a canned food to appear to drink less water because of such a high moisture content in the food, versus a cat eating dry food or kibble tends to drink more water to account for what is missing in the food. And some cats you may never see drinking, and this comes from the cat's nocturnal behavior. As a species, they're nocturnal. They are most active at night. So you may be missing these behaviors while you're asleep, unless you have a camera on your cat. If you have a cat that you never see drink, but they are healthy at their veterinary visits, they likely fall into this category, and I wouldn't get too concerned. However, if you have that cat and suddenly you are seeing them drink, that is when I get concerned. Let's talk about where we draw the line between a normal variation and that red flag. There is a specific word and definition for excessive water intake, and it's called polydipsia. Effectively, we're drinking too much water. And the number for that is 100 milliliters per kilogram per day. For most cats, that's a significant increase in water intake. And even if you are not seeing them do it, you may see the water bowl getting drained faster, or you should definitely be seeing it in the litter box. Either they're going more often or those urine clumps are getting bigger. When cats cross that boundary, they're not just extra thirsty. Something is going on that is driving their body to tell them to drink more water. Drink more water, you get more urine. In senior cats especially, this can be one of the first signs we see that something is wrong. Cats with medical conditions will almost always drink more water than a healthy cat. And common causes can include chronic kidney disease, diabetes, hyperthyroidism, gut diseases, urinary tract infections, and even some of our medications. Another metric that we can look at is called the urine-specific gravity. And essentially this tells us how well the kidneys are concentrating the urine or how much water they are pulling out of the urine and back into the body. Healthy cats are very adept at having a high urine-specific gravity because their bodies are really good at pulling as much water as needed out of the urine and keeping it in the body. Because of this, if that urine-specific gravity is high, we can usually say the kidneys are working really well, but it's not always a great indicator of hydration looking solely at that number. We really need to take the entire clinical picture into consideration. A normal cat typically has a urine-specific gravity greater than 1035, or we write it down as 1.035. If a cat's urine specific gravity is consistently below that 1035, that can be an indicator of a disease process going on, or some of our therapeutic diets will actually cause this number to drop too. So it may be intentional, but obviously we hope you would know if we're trying to do an intentional drop in specific gravity. When the urine specific gravity is really low, so less than 1008, 1.008, I know how we say it is weird, but if your cat's urine specific gravity is less than 1008, then we get even more concerned about some of our rarer diseases like diabetes insipidus, a high calcium level, lead toxicity, pyometra or uterine infection. That's not an issue if your cat is spayed. And something called hyperaldosteronemia is another one. Again, these are usually pretty rare, but the lower that specific gravity gets, the more concerned we are about those specific diseases. If you're concerned specifically about your CKD cat and how much water they should be drinking, that gets even more complex, and it depends on a number of factors. Factors like what stage of the disease they are in, what are they eating, how much are they drinking on their own, are you giving them subcutaneous fluids, and then what is their body doing with all of these resources. So when it comes to something as specific as CKD, you're likely going to need a hands-on veterinary exam and lab testing to really give you the full picture. Another common question that comes up with this topic is what type of water should my cat be drinking? And really the simple answer is the type they prefer. Not what you prefer, not what the internet prefers, and not what all the keyboard warriors prefer. This is an area where caretakers often feel unnecessary stress. There's a common concern that tap water might not be safe enough, or that bottled water is somehow healthier, or that softened water can harm the kidneys. For cats, the most important factor is that your cat is willing to drink it. The type of water matters far less than people think, aside from we don't want it to be obviously polluted water if we can help it. In typical household environments, the mineral content of tap water, filtered water, softened water, any of the things that you would find in your home is unlikely to make a meaningful difference or harm your cat. At this time, there aren't any peer-reviewed studies showing that these small variations affect the kidneys, the urinary tract, or any of our long-term outcomes. So really, the priority should be palatability, or how does it taste to your cat, and that they are willing to drink it. Don't forget availability too. If your cat prefers running water, then a fountain is probably more suitable to your cat. If they like wide ceramic bowls, use those. If they drink happily from tap-filled bowls, that's fine too. It's truly about that happy medium of your cat drinking water. Understanding hydration in cats also means understanding cat biology. Cats are amazingly skilled at hiding illness, and that instinctive behavior is shaped by evolution. They are solitary hunters who need to avoid appearing vulnerable just to survive. That means changes in water intake, something that subtle, may truly be the first indication we get that there's something wrong with your cat. That's why we're constantly asking you as veterinarians, is your cat drinking? Is your cat urinating? Is it their normal? Is it more? Is it less? I know those questions can be annoying, but that's why we're asking them. It's often our first clue, and cats don't commonly drink a ton of water or urinate a lot. Those changes are clinically relevant. One of the most important things you can do is monitor for those changes rather than getting hung up on how much should my cat be drinking or what should my cat be drinking. Because again, if you have that cat that you never see drink and now suddenly they are at the water bowl, that change indicates something is happening or going wrong. If they're playing in their water bowl, if they're hanging out at the water bowl, if they're asking for more water, if they're at the faucet more often, those are all concerning. It's a good idea to contact your veterinarian if you see your cat drinking more than that 100 mils per kilogram per day, if you notice larger clumps in the litter box, or the box is suddenly wetter than normal, if your cat's urine seems consistently very dilute, or more water-like rather than that smelly cat pee version, they start visiting the water bowl more often, or again, obsessing over it, or if you see any new vomiting or weight loss, or changes in appetite associated with that change in water intake. In older cats especially, these changes can be hallmarks of chronic kidney disease, diabetes, hyperthyroidism, urinary tract changes, and gut disease. And all of these conditions are far easier to manage if we catch them early. In the end, your goal should not be to get your cat drinking this perfect amount of water. Instead, your goal should be to create an environment where your cat is happy to drink and it's easy and it's natural. A few simple strategies to make that happen are to offer multiple water sources, making them especially easy to access for our senior cats, keeping the bowls clean and filled. If your cat prefers running water, try a fountain. If your cat prefers low, shallow bowls, use them. And if your cat is hesitant to drink, you can try flavoring the water or adding a little bit more water to canned food. And keep in mind, none of this is a hard, fast, rigid rule. They're practical adjustments and theories that can help keep your cat better hydrated. So I know I went over a lot. In summary, the normal healthy cat generally drinks between 50 to 60 milliliters of water per kilogram of body weight per day, or about 7 to 12 ounces of water. A consistent intake over 100 milliliters per kilogram per day is considered abnormal, or polydipsia, and that warrants investigation. And a cat's urine-specific gravity that's considered normal should be above that 1035 mark. And you can stop losing sleep over the type of water. That's not nearly as important as focusing on the fact that your cat wants to drink the water you are offering them. It's great to know what your cat's water intake is. It's a simple, non-invasive way to really monitor their health and catch disease early. And this is why your veterinary team drives you crazy and asking all those questions. If you found this video helpful and you'd like more guidance on senior cat care, hydration strategies, or interpreting lab values, please explore the other videos on my channel. And thank you for taking such thoughtful care of your cat.